Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Forensic Medicine and today we'll continue with regional injuries. In today's video, we'll discuss about regional injury mainly on the skull. So skull is a bone comprising mainly of outer and inner table. Outer table is twice the thickness of the inner table. It also mainly consists of a skull made of vault and the base of the skull. Thickness of the skull varies from place to place. It may vary from 6 mm to 10 mm in frontal and parietal regions and 50 mm in occipital bone, 4 mm in the temporal bone. Skull is thicker in the mid-frontal, mid-occipital, parieto-sphenoidal, and parieto-petrous buttresses. The force required to cause fracture of the skull varies depending upon the area of the skull struck. So, if thinner portion of the skull fractures easily compared to thicker near the petrous regions. Thickness of the skull it also depends upon the thickness of the skull, also on the scalp and hair. If the scalp and hair is present, the force acting on the skull is very reduced compared to bald skull. And also the direction of the impact and other factors is important in causing skull fractures. Skull fracture may be caused by direct injury or by indirect injury. Direct injury caused by compression by any way, like example in by midwifery forceps or crushing of the head under the wheel of the vehicle, or an object in motion striking the head, like an example in bullets or bricks or any weapon, masonry, machinery, anything which object struck on the skull. And if the head in motion and strikes any fixed object, like as in falls or in traffic injuries, where the head strikes the hard object. So those are direct injuries. Indirect injuries are those in which the force acts indirectly on the skull through some other structures which receive the primary impact. For example, fall on the buttocks. So if the person falls on the buttocks, the force transmits to the vertebral column and impacts the base of the skull and leading to fracture of the base. Next, also sometimes in blow on the chin may result in the fracture of the base of the skull. So in this, the injury is not primarily directed on the skull itself, but it is indirectly by the other regions, which leads to fracture of the skull. Usually, the force of 400 to 600 pounds per square inch is required to cause a skull fracture, which is intact with hair-bearing scalp. Skull fracture can occur without any significant or detectable brain injury. So we should know that if there is a skull fracture is there, sometimes only skull fracture, even the fracture is there, brain injury will not be detectable, or there is no impairment of consciousness. Vice versa, conversely, if there is a fatal brain injury, there may not be any fracture also. So the conditions for brain injury differs. Not only it's not dependent on the skull fracture. Now coming to mechanism of fracture of the skull, fractures is mainly because of local deformation. In this, sometimes local deformation in the skull's deformation in the skull itself. In this, the any mass traveling at a sufficiently great speed strikes the head squarely. It will drive inwards and cause a cone-shaped dentation. So, if any object like some bullet or any object strikes the skull, it dents the skull because it has the outer table and inner table. So it has a cone-shaped indentation. And if the force continues to act, the fracture of the outer table follows and a completed fracture lines runs radially. So again, if the force continues, the object travels inside the brain and it may cause the fracture of the complete skull. It's mainly locally. If there is any deformation in the skull, means local acting force causes the fracture, or fracture due to general deformation. Here, the skull itself is compressed. So in local deformation, local point of the skull is acted. In the general deformation, whole skull is compressed laterally or vertically anyway. There is a shortening in line of pressure, which while the vertically longitudinal diameters are decreased, due to which parts of the skull distant from the site of application of the engineering force are bulged and may cause fracture by bending. So we can see in this image. So if in this case, if two parts of the skull is compressed, and compressed in the sense it may be compressed by in case here maybe a road and here maybe a vehicle. So if that is causing the compression, because of compression the skull may bulge out and it may lead to fracture of the skull because of general deformation. The head may be compressed between two external objects such as ground and wheel of the vehicle, or between the external object and spinal column. In the spinal column means the head may be the force is driving vertically, and head may be driven into the vertical column and leading to fracture of the base of the skull. So anyway, when the locally in local deformation, local object drives the force, drives the bone to fracture. In general deformation, the skull is compressed in both sides, and because of compression, the part opposite to that, perpendicular to that, bulges out and gets fractured. Now coming to classification of skull fractures, it can be broadly classified into vault of the skull fractures and base of the skull fractures. So in the vault of the fracture, there are different fractures like fissure fracture, depressed fracture, elevated fracture, pond fracture, comminuted fracture. In that there is stellate fracture, mosaic fracture, diastatic fracture, gutter fracture, and perforating fracture. Coming to one by one, fissure or linear fracture. So in this, there is a linear fracture occurs in the skull. So the suture line is present, but any fracture occurs, there is a small hairline fracture occurs in the skull. These are linear cracks passing over the vertex or across the skull base without any displacement of the fragments. So there is only there is a hairline or fracture, linear fracture occurs. There is no displacement of fragments and doesn't involve whole of the thickness of the bone or inner or outer table. It may be inner table or outer table alone. Both, not both is involved. It mainly caused by forcible impact against a broad resisting surfaces like a hard ground surface, or in case of rotative extent, or when knocked to the ground by a blow of fist. It may be there. So any local action of that may lead to fracture. Blows with the hard blunt objects like relatively broad striking surfaces like a hammer can cause fissure fractures if it is driven lightly. In fissure fracture, the fracture line tends to follow an irregular course and is no more than a hair's breadth. So it may be not be more than hair's breadth. It just offers a irregular course, just a linearly it may cause. They are very difficult to detect, may not be seen on X-ray also, and can only be detected at the time of autopsy if the person has died. The line of fracture runs parallel with the axis of compression. So it really acts, usually the compression force usually perpendicular to the opposite to the parallel to the fracture line. So this is the linear fracture. So in fissure fracture, Pipet's rule is applicable, in which states that when two blows are struck, the fracture line produced from second blow are arrested by those produced by the previous blow. So in case of two blows, when the first blow causes a fracture, the second blow is stopped by the first blow. So that entails that if one line of fracture is stopped by the another line, that indicates that the which fracture is stopped is the second fracture. And it's also determined the sequence of fractures or the sequence of blow fractures has occurred. So this will again really helpful in the case for evaluation purposes. Now coming to depressed fracture. So in depressed fracture, a portion of fractured bone is driven inwards and it is known as a depressed fracture. So in this image you can see a part of the skull is driven inside. So this occurs by a very single small object acting locally. So it is also called as fracture or la signature or signature fracture, as the shape often points toward the shape of the offending weapon. So typically the shape causing the depressed fracture leaves the mark on that, which will be resembles that shape only. They are caused by blows with heavy weapons having small striking surfaces such as hammer, axe, brick, or any chopper. So anything acts locally it may drive the bone to depressed. The risk of post-traumatic epilepsy following depressed fractures and lacerations are more. So depressed part of the fracture line may cause laceration of the meninges and may also cause the brain damage by blood vessel ruptures, and may lead to post-traumatic epilepsy, which is percentage is 15% chance of epilepsy occurring in this depressed fracture. Now coming to elevated fracture. In this, one end of the fracture fragment is elevated. So one end of the fracture is elevated above the surface of the skull, while other end is dipped down into the cranial cavity, resulting in the brain damage. So this is fracture occurring where one end of the fracture is elevated, other end is driven back, and this part, driven inside part, will damage the brain. It is caused by a blow from a sharp, heavy objects like an axe, which elevates the skull fracture by lateral pull of the weapon by retrieving it. So usually causes sometimes when heavy blow with heavy weapons like axe or a chopper. Pound fracture, also called as intended fracture. This is a fracture mainly occurring in case of infants or less than 4 years of children. In this, there is a smooth concave depression without a fracture line, resulting from inbuckling of skull, occurring only in elastic skull of infants and children. So, in children's, the skull is elastic. So, because of that, when there is local pressure occurs, the part of the skull get depressed, but it is not fractured. There is a depression, but there is no fracture line is present. So, that is why it is called a Pond fracture. It may also be caused by forcible compression with obstetric forceps impact against the protruding objects. Also, sometimes if the baby head is impacted on the protruding objects like sacral promontory, it may also cause pond fracture. It is also known as ping pong fracture, as it looks like a similar to dent in the ping pongs. Now, coming to comminuted fracture, it's also known as spider web or mosaic fractures. In this, there are two or more intersecting lines of fracture divide the bone into three or more fragments. So there are multiple fracture lines are present and divides the skull into multiple fragments. The skull bone gets broken into multiple pieces of fracture lines, which are haphazardly or coincidentally arranged or stellate, means in a star shape if they radiate from the site of impact. So the impaction, the skull fractures may be present in the concentratedly or it may be present in the star shape based on how the impact force is present. It is caused by, in case of vehicular accidents, fall from height on hard surfaces, or by blows with weapons having large striking surfaces such as heavy iron bar or from a bullet. Comminuted fractures may be complication of fissure fracture, and the fragments of bones sometimes may be displaced inwards, forming a depressed fracture. In that only mosaic fracture is a one, which is a non-depressed comminuted fracture where fracture site appears in the form of several fissures forming a spider web or cobweb design or mosaic pattern is occurred. So this is a form of comminuted fracture where the fracture lines forms a spider web design or a mosaic pattern. In this, degree of depression is minimal or absent. Next fracture is gutter fracture. It is formed when the part of thickness of a bone is removed. So in gutter fracture, part of the thickness of the skull is removed, forming a gutter or oblique. It may be example is caused by oblique blood wounds. So in this image, you can see there is a part of the skull is being removed by the striking bullet. It usually accompanied by comminuted depressed fracture of the inner table of the skull and fragments causing injury to the meninges in the brain. Next is fracture is a diastasis or sutural fracture. It usually occurs in young children following a forcible blow on the head with a heavy hard blunt object where the fracture line passes through the sutures. So we all know that skull is made up of different sutures, the coronal sutures and lambdoid sutures. So usually diastatic fracture occurs where these sutures are present and they get separated. So the diastatic sutural fracture is in those occurs in the young children where the fractures, the suture line, it gets separated. It may occur alone, but is often associated with fissure fractures. Next fracture is a perforating fracture or punctured fracture or hole fracture. These are caused by firearms and pointed sharp weapons like dagger or knives or axe. So in this, the weapon passes through the both tables of the skull, leaving a more or less a clean-cut opening. So in this, there is a clean-cut opening in the skull. A hole may be present, may caused by the pointed object, mainly by dagger, knives, or bullets. The size and shape of which corresponds to the cross section of the weapon used. So example is mainly the bullet wound, which may enter and exit from the skull, leaving a circular hole resembling the bullet size. Next fracture is the expressed fracture. In this fracture, it is form of a comminuted fracture where there is a massive fragmentation of the bone, fragmentation shattering of the skull, where some pieces may be found outside of the head. So the fracture is so severe that the parts get fragmented and expressed outside. They occur due to massive trauma, often involving the contact or post-trauma firearm injuries or due to bomb blasts. Next is fracture of the base of the skulls. So those are the wall fractures, mainly the top, the part of the skull fractures. Next is the base of the skull fractures. So first is a basilar fracture, which may be anterior cranial fossa, middle cranial fossa, posterior cranial fossa fractures. Next is ring fracture, hinge fracture, longitudinal fractures. So basilar fractures occurs mainly in the base of the skull, which is weak, and hence any diffuse impact to the vertex of the skull may produce basilar fractures. So any impact on the skull, on the head, may also impact the base and may result to basilar fracture. These fractures may be missed on the X-ray examination because it is very difficult to detect. So the fractures, the base of the skull usually divided into anterior cranial fossa, middle cranial fossa, and posterior fossa, mainly made up of occipital bone. So anterior fossa made by frontal bone, middle cranial fossa is made up of mainly the temporal bones, and posterior fossa is made up of occipital bone. So anterior cranial fossa fractures usually occurs due to direct impact, although there is a fissure fracture in the orbital or cribriform plate. So impact on the frontal regions, mainly orbital, can cause this fracture. It may be accompanied by fissure fracture to orbit or cribriform plate. The patient presents with epistaxis, caesareoproteinuria, is anosmia, necessitative paresthesia, and black eye. Occasionally, corticocavernous fistula. Corticocavernous fistula may also occur. Fracture of middle cranial fossa, it is seen due to direct impact behind the ear or crushed injury of the head. So mainly in the sideways impact it causes. It manifests as CSF otorrhea, hemoptympanum, oscillatory disruption, battle sign. So battle sign is hemorrhage behind the mastoid. So there is a bleeding in the ear, bleeding which gets deposited behind the mastoid, leading to called as battle sign. Or middle cranial fossa fracture may also lead to 7 or 8 nerve cranial nerve palsy also. Then fracture of posterior cranial fossa, it is commonly due to direct impact of the back of the head on the ground and clinically diagnosed by escape of blood and CSF through the mouth. So any impact on the back of the head may lead to this fracture. It can be diagnosed by blood and CSF through the mouth. So these are different variants of basilar fracture. Next is a ring fracture. This is a type of fracture that encircles the base of the skull around the foramina magnum, running from sella turcica partly through the petrous bridges and then going posteriorly and medially joining the posterior fossa. So this is a fracture usually seen parallel to the foramina magnum, which is the opening for the spinal cord. So it runs from sella turcica and usually ends with the posterior cranial fossa. In the front, the fracture may pass through the middle ear and roof of the nose. As a result, the skull gets separated from the spine. So because of this, the skull may get separated with the ring fractures. It occurs usually because of fall from the height on the feet or buttocks when the force of the fall is transmitted upwards to the spinal cord. So spinal cord pushes, the vertebral column pushes on the foramen magnum and causes the ring fracture. What of the skull may also be driven against the vertebral column. So one is the buttocks may lead to it may be driven inside, or sometimes the head may be driven in the vertebral column by heavy load or heavy blow on the over the vertex. Sometimes violent twisting of the head on the spine, shearing the may also cause a shearing from the base. Heavy blow directed underneath the occiput or chin also can lead to ring fractures. Now coming to hinge fractures, it's also called as transverse fracture or motorcyclist fracture, mainly because it is seen in mainly in the motorcyclist fracture accidents. This fracture of the base of the skull occurs completely splits it, creating a hinge, frequently occur in the side impacts. Most common form which extends from the petrous bony ridges from the sella turcica to the lateral end of contralateral petrous. So this usually occurs in the petrous bony ridges and accompanies the sella turcica, which is present here, and laterally ends to the contralateral petrous bone. So this causes the bone to get separated in two parts in the form of a hinge. Next is longitudinal fracture, which longitudinal fracture of the base of the skull runs from front to back or back to front. So it usually runs on the longitudinal to the base of the skull, dividing the bone into two parts. It may run from front to back or back to front. Next is a blowout fracture. This is due to blunt trauma to the eye, wherein the forces are transmitted via the globe of the bony orbit, causing the disruption of the orbital walls. So any blow on the eye can lead to disruptions of the orbital bony ridges and cause the orbital walls fractures. That is called a blowout fracture. Then counter coup fractures. So coup and counter coup is the coup fracture or the coup fracture. Coup is where there is a point of impact. So in any skull, when the force is applied on the point of impact, is called as coup, and if the injury is opposite, it is called as counter coup. So this counter coup injury is where person has met with a rotor of accident. The force of impact was in the front, but the back of head hit the back on the hard surface like a rotor of accident, leading to in fracture in the backside also. So it occurs opposite to the site of impact of the primary impact or coup violence. This is due to shear strain. It is usually seen in the anterior cranial fossa involving the bones of the orbital or femoral plates with associated periorbital hematoma. So since the anterior cranial fossa is thinnest, so any injury to the back of the head may cause the front region to go hit the any hard object, may lead to orbital femoral plate fractures. They occur after an occipital, parietal, or temporal impact along with fracture of the site of impact. So there may be primary impact fractures may be also present, plus counter coup fractures also present. The coming to complications of skull fractures. So any skull fractures, there may be the different complications. One is mainly the injury to the brain. So any fracture may cause complete with injury to the brain, which may be dangerous to life, causing maybe lead to epileptic edema and death also. There may be massive hemorrhage because injury to the blood vessels. In case of if there is a middle meningeal artery is ruptured, fatal hemorrhage may occur. Then is infections. It may occur because of direct spread from compound fractures or spread from the fracture of the frontal nasal sinuses or from like frontal or ethmoidal fractures. It may be spread to the brain. Then traumatic aplasia, which is a more common in with open hand injuries, which usually seen in 1 to 2 years after the episode and manifest as clinic fits. So main complications are injury to the brain, infection to the brain, hemorrhage, and epileptic episodes, traumatic mainly seen after some days of head injuries. Now coming to circumstances of fractures of the skull. So most common fractures are due to because of accidents. So all types of most of the skull fractures are because of accidents or road traffic accidents, fall from the height, fall from the heavy, fall from the any construction working. So most of the time is accidental. Sometimes multiple localized and depressed fractures are commonly seen, suggest the homicidal nature. Suicide by head injury is very rare because it is very painful, cannot be produced. It may be seen in case of mentally ill, where the person may try to hit the head on the hard surface and may lead to fractures. These are my references. Thank you.